The hospital is working hard daily to provide quality care to its patients. There are many actions that take place behind the scenes to coordinate the care that the patient receives upon entering the hospital. One of these behind-the-scenes actions is provider scheduling. There are many rules and restrictions to abide by, all while ensuring there is a provider on every shift, every day. Hi, I'm Terralyn O'Gara, and I'm a senior in Industrial and Operations Engineering at the University of Michigan. And I've been a part of the research team this summer developing a scheduler for the residency program for the University of Michigan Pediatric Emergency Department. Building a residency schedule can be quite difficult when considering all the requirements implemented by the ACGME, not to mention allowing for adequate sleep schedules, requested days off, and equal shifts per resident. It was a very challenging task for schedulers to come up with a usable schedule by hand. It often took scheduler days of placing residents in shifts each month, then backtracking and hoping no rules were broken. And once the scheduler found something out of place, they would often have to restart the entire process of placing residents in shifts. Even then, the schedules created were often unbalanced, forcing residents to trade shifts themselves. It was a very tedious task and not an efficient use of time. Fortunately, we have created a computer program that accounts for all these constraints and uses engineering principles to produce an optimal schedule within seconds. The University of Michigan Pediatric Emergency Department is currently working with us and using the program we created to develop a reliable schedule for their residents. Monthly, we meet with the chief resident that is responsible for creating the schedule. Collectively, we simulate different feasible schedules by modifying the parameters slightly. If the parameters are too tight, we find that there's no possible schedule to accommodate everything that is being asked for. From there, we relax the parameters and create a schedule that is feasible and desirable to the chief resident.
Hi, my name is Micah Long. I'm the pediatric chief resident that does the emergency department scheduling for the pediatric residents in the CS Mott Children's Hospital. I've been the lucky one to benefit from the scheduling program. I'm able to improve sleep consistency for my residents and help them meet all of our residency duty hours. I've been able to increase how many shifts we provide coverage for in the emergency department. I've been able to get residents more frequently and more consistently to their outside continuity clinics. And with all of this, I've done it in about 10 hours less time per month with fewer mistakes and fewer resident complaints. It's been excellent.
As we continue to work with the University of Michigan Pediatric Emergency Department, we are figuring out new ways to develop the program and grasp a better understanding of what an optimal schedule actually is. We plan to continue working with the University of Michigan Hospital to develop an optimal schedule for their residents, further aspiring to bridge the gap between the engineering and healthcare fields.